Hello, everyone. I'm Dr. Farah Ingale, Senior Consultant Physician Diabetologist and Director, Fortis Hospital, Vashi, Navi, Mumbai. Today, I would be talking on diabetic foot. Diabetic foot is a major issue seen in most of the diabetic patients, especially when diabetes is not under control. We all know when the blood sugar goes too high. That means, for your information, when the fasting sugar goes more than 110, post lunch sugar goes more than 140, and an HbA1c of more than 6.5, उसे हम डायबिटीज़ कहते हैं. अब डायबिटीज़ दुनिया भर के लोगों को अफेक्ट करता है. आज के दिन में अबाउट 550 मिलियन लोगों को डायबिटीज़ है दुनिया भर में, और हमारा कंट्री इट इज़ होस्ट टू द सेकंड लार्जेस्ट नंबर डायबिटिक्स ऑफ द वर्ल्ड. यानी दुनिया के सेकंड लार्जेस्ट पॉपुलेशन डायबिटिक्स के हमारे कंट्री में है. और हर 7 मिनट में या हर 5 सेकंड में एक डेथ डायबिटीज़ के वजह से होती है. डायबिटीज स्पेशली जब कंट्रोल में नहीं रहता है तो कॉम्प्लिकेशंस होते हैं जो हमें ऊपर से लेके नीचे लाइक फ्रॉम हेड टू टो योर बॉडी कैन गेट अफेक्टेड. यानी उदाहरण के तौर पे स्ट्रोक्स हो सकते हैं या पैरालिसिस का अटैक, जो 7 टाइम डायबिटिक्स में ज़्यादा कॉमन है कंपेयर टू नॉन डायबिटिक्स, स्पेशली जब शुगर्स कंट्रोल में नहीं रहती है. आंखों के प्रॉब्लम्स हो सकते हैं जैसे ग्लोकोमा, रेटिनोपैथी, इमैच्योर कैटरैक्ट्स. हार्ट अटैक हो सकता है, एंड हार्ट अटैक्स आर 2 टाइम्स मोर कॉमन इन डायबिटिक्स कंपेयर टू नॉन डायबिटिक्स, and that too without any symptoms or signs. That is called as silent infarct. You can get kidney failures, you can get neuropathies, you can get nephropathy, and most important and last but not the least is diabetic foot. Now, infections can occur, especially when sugars are not under control. And when there is infection, sugars will go up. If the sugars are high, infections will not come down. It's like a vicious cycle. So it's very important that we do regular checkups, keep the sugars under control, keep your lifestyle proper, exercise every day, do regular checkups. Because diabetic foot, if it occurs, to begin with, it begins with a small lesion on the foot. Actually speaking, foot is a very small structure, but we stand on the foot, we walk on the foot. It is the locomotor system of our body. One small foot has 26 bones, so 2 feet together has 52 bones out of the total 206 bones in our body. There are hundreds of muscles, ligaments, and cartilages in the foot, which makes it an organ on which we walk and we stand. It's a locomotor organ of our body. And if it gets affected, you will not be able to walk, you will not be able to stand. And if you're not able to walk, actually speaking, the latest mantra is mobility is longevity. Then your health is definitely going to get affected. And the problems begin with callosities, corns, then there can be an ulcer which goes deep inside. It gets infected. There is cellulitis. The blood supply to the foot gets affected. The nerves of the foot gets affected. Finally, there is gangrene, is after ischemia because there's no blood supply on the foot, and the foot becomes unsalvageable and you have to ampute or cut the foot off. So, if you don't want all these complications to happen, you have to take good care of yourself. Keep the sugars under control with proper lifestyle. Follow diabetic diet, meaning avoid taking sweets or carbohydrates in excess, especially those carbohydrates that have high glycemic index. Go for high protein diet. Avoid saturated fats in the diet. Have some activity on regular basis. Go for walks maybe for 30 minutes every day, or some other alternate physical activity. You can go for stretching exercises, especially if you're an elderly where physical mobility is limited. And yoga has its own benefits, stretching exercises has its own benefits. Then there should be no stress, because total health is physical plus mental health. You have to be relaxed mentally. Otherwise, with proper diet, exercise, and taking medicines also, if you're not at ease mentally, your sugars will not be under control. So that is also important to look into. And then have medicines on time as advised by the doctor, and get regular checkups done. Otherwise, diabetes, as it is a progressive disease. Over a period of years or months, also, you can say it can increase, because beta cells in our body gets exhausted, and the insulin production in our body, insulin sensitivity reduces, and resistance increases. So you require more and more medicines in spite of following proper diet, exercise, and taking medicines on time. So keep your sugars under control. About foot care, use a proper footwear. When going out of your house, it is advisable to wear comfortable shoes. The leather has to be stretchable. It should not be too tight. It should not be loose. And it has to be comfortable and cushioned footwear with cotton socks, which are thick. And then, secondly, you have to wash your feet every day with mild shampoo and water, and dry it up, and then apply a moisturizer. If you don't dry your foot properly, then you will get fungal infections. Use a moisturizer, because otherwise, if the skin is dry, there will be cuts and abrasions which can get infected. Then, secondly, cut your nails properly. Don't cut it too deep. Otherwise, you'll get ingrowing toenails, and you'll get nail infection, nail bed infection, especially. So, all these are very important. Foot care is very important. Before going to bed, check your foot every day for any skin discoloration, cuts or bruises or corns or callosities. If you notice anything, report it to your doctor, get yourself checked, and take necessary precautions and treatment as advised. Even at home, you should use a proper footwear. Don't walk barefoot anywhere, even in your house. And when you wash your foot, use lukewarm water. Don't use very hot water, otherwise, your skin can get burnt. If you take all your precautions, your foot will be safe, and you will avoid injuries, and you can pick up problems early, by which your foot can be saved. So, all these precautions you need to take, get regular checkups done, and keep the sugars under control. Then only you'll be able to put your best foot forward. Thank you so much.